And a good Saturday morning to you. Welcome once again to Health Matters on WFEN with Jim Warner of Warner Chiropractic in Rockford, Illinois, located at 4855 East State Street. Dr. Jim isn't too much of an activist, but he's an activator for sure. And that kind of is the topic today, isn't it?
Good morning. Yes, it is. For listeners that don't know what the Activator method is, it's a way to do chiropractic that began probably about 35 years ago and has grown to be the number 2 most popular way of doing chiropractic adjustments in the whole field of chiropractic. And approximately 65% of chiropractors have had some training in this Activator method of chiropractic.
And we have a special guest with us on the program again today, and that's Kim Osborne from your office.
Yes, and Kim, maybe you can introduce yourself and tell us a little bit about yourself.
Well, good morning. My name's Kim Osborne. I'm an intern at National University of Health Sciences, and I'm in my final year of studies, and I'm going to be doing part of my internship at Dr. Warner's office, so I'm there on Tuesdays and Fridays every week through the rest of December, through the rest of this year.
Well, great. And Dr. Jim, you were saying that the Activator is the second most popular method of chiropractic, which begs the question, which is the most popular?
Okay. Well, most people are familiar with chiropractic where the doctor will adjust the spine manually and it'll make noises and such, and people are maybe familiar with that. Some people may be afraid of having it done that way, although it is a safe way to do it. But the Activator method is actually a way of doing chiropractic with a handheld instrument that the instrument does the actual adjusting. And so there's really there's no pain, there's no manipulation that actually takes place. The instrument which you set beforehand does the actual adjusting of the spine. So it feels like a click on the body. Nothing more than a little click, and yet it gets phenomenal results.
Now, in my experience with you, you normally use both of those types of chiropractic when you are working on me, I know.
Yes. Well, once in a while, one way of chiropractic doesn't fix everything. And so it's good to know several different ways of doing chiropractic so that if one way isn't working correctly, you can try a different method.
And are there yet other methods besides those two?
Yes, there are. There's probably 10 or 15 pretty common methods of doing chiropractic. Now, maybe I should just talk a little bit about maybe the scientific thought behind the Activator method. Back in the early 70s, there were 2 chiropractors by the name of Dr. Lee and Dr. Furr that used to give chiropractic adjustments manually, and they did it more with their thumbs and their fingers. It was a gentle type adjustment, but they found out that their thumbs and their fingers were wearing out. And a dentist was one of their patients, and the dentist said, you ever think of using a dental mallet for adjusting the spine? And they thought, no, we didn't know what a dental mallet was. So he brought in an instrument, a spring instrument that was a little mallet that you just squeezed the trigger, and then it caused the hammer to go, and it gave a little click. And the dentist actually used that to remove people's teeth.
So if the tooth was stubborn, they would knock it out with the mallet.
That would be one way to remove the tooth. So they had to change it a little bit to adapt it towards chiropractors because we didn't want to take anybody's spines out.
For sure.
But anyway, so they took like a rubber stopper and put it on there, and it seemed to work a little bit. So then they just changed things around, improvised it, and then eventually came around with a spring instrument that we call the Activator to adjust the spine. And so that made some changes too over the years, and it was probably about 3-4 years ago that we went to more of an electronic instrument, which does the actual adjustment, but does it like in rapid fashion, kind of like a woodpecker clicking there. It'll do maybe 10 or 15 adjustments per second, and so it's a repeating instrument that does the same thing but does it extremely well.
So these chiropractors were feeling around the back for problems with their thumbs, and they could be more specific at the point where there needed to be
as
pressure.
As far as the adjusting is concerned, they adjusted with the thumbs. They palpated with their fingers or felt where the bones were out of place. But both of them came from a college, a chiropractic college that was teaching that if you take a look at the lower part of the spine, that's the most important part, and if you fix the lower part, that would fix a lot of the problems above them. So they studied the hip structure quite a bit, and they were very interested in seeing if the legs were equal in length. And so if they would find somebody that had one leg shorter than the other, maybe the left leg or the right leg was shorter, when they measured them lying down, then they looked to see what type of adjustments they could do to the buttocks area to straighten out the leg length. And so they developed a system of tests where you check the leg length to see if where the problems lie, and then you give the chiropractic adjustment with an instrument, and then you recheck the leg length to make sure that the actual adjustment was accomplished.
And it doesn't take much, I know, and you can actually see the difference after that adjustment. Is that right?
Absolutely. It's real subtle changes, and the more you study it, the more you can read exactly what the body's telling you and where to adjust at.
And, of course, if you get one part of the body straightened out, then it helps the other parts to come into alignment.
Yeah, see, with a lot of chiropractic treatments, let's say someone comes in and to the chiropractor and they have a neck problem and their neck hurts. But the chiropractor does the examination and can see that there's actually a problem in the hips and the lower back, and that is crooked down there. And if you fix the neck, it's going to keep coming back because there's still an underlying problem that is not being corrected. And so when you look at it that way, we try to analyze the whole spine and then fix the problem below and work our way up the spine. And that's pretty much how Dr. Osborne and I work. We try to fix the hips and go all the way up the spine. And therefore, if you can fix the cause of the problem, then the treatment's going to work a lot better, and maybe the problem will go away and not come back. However, if you treat just the problem, which is maybe the neck, and you don't fix the underlying problem, then you're not going to get the results.
That's the same underlying principle that you have when we talk about drugs and how drugs are used to maybe deaden the pain, but you're really treating a symptom rather than the problem.
Absolutely.
Absolutely. It's like putting a Band-Aid over the problem but never fixing the problem in the first place.
Now, the Activator, that instrument, do you ever use the old single-click one, or do you use the rapid one now only?
Almost always we're using the arthrostim, it's called. It's the rapid adjuster. And we occasionally might use the regular adjusting instrument again, maybe with newborn infants. You know, somebody that we want to adjust maybe just a millimeter. That's a small amount, but maybe just a millimeter on a newborn baby, or maybe some patient that might be extremely elderly in their 90s. We have some 90s close to 100. Someone like that, we might want to just move it just a millimeter. And so if that's the case, then we would use maybe the regular Activator.
The amazing thing with either of those tools is that you can hardly feel it. You feel a little rat-tat-tat, but it's almost as if I took my finger and tapped your back. That's about what it feels like.
Yeah, that's the way it feels, and yet it's a very powerful adjustment.
I know that it is.
And there's people that are afraid to go to a chiropractor because they heard that they're going to have their neck twisted or something like that, you know, and they're thinking, man, I'm going to leave and I'm going to hurt more than when I got there. And so that's what goes through people's minds, and we want people to know that, hey, that's not the case. You're going to feel better when you leave and not feel worse.
Now, when a person does walk out of the office, and one thing you've told to me when I have received relief is that maybe you should walk around for a little while, because I want to make sure that this adjustment that I made stayed. And I thought that was interesting.
Absolutely. You want to, because what we're doing is leveling out the pelvis, making sure the leg length is equal, and we want to see you actually in motion, and what we did is make sure that it had an effect and it held. And so we'll check it sometimes to reevaluate that and make sure that we did get the problematic areas.
Sometimes when someone is out of alignment and you adjust the spine and things are back in alignment, they need to walk around and move around a little bit so that the rest of the body can adjust to that change. So that's why walking seems to help. And then another thing is that once you put the body back in alignment and you restore mobility, in other words, things are starting to move better again, then if they walk around a little bit, that reinforces that movement, and so it helps keep that original problem from coming back.
So it's like, I never was a model, but Dr. Jim says, walk for me a little bit. I want to see how you're moving. And it makes a difference.
Yeah, we do that. And then another thing that we check when people are walking is that we look at their hips and see, when people walk. And of course, you can think, I know you're not a model, Fred, like you said, but if you picture a female model, and females, of course, when they walk, their hips move a little left, right, goes back and forth. And when you look at that closely, sometimes when people walk, it either they're not shifting their hips, or maybe it shifts to one side and not the other, and that'll help you identify where the problem is in the hips or where the hips are not moving. So that's why we like to watch people when they walk, just to make sure that the biomechanics are corrected.
So you're shifting bones back into their proper position when you use that activator, but what about like a subluxation? Can you use it for the same type of thing?
Well, the subluxation would be defined as the bone that's out of place, so to speak. And so when we're treating that, that's exactly what we're treating, and we're treating the muscles that surround that area as well.
Okay, I was thinking of a subluxation as something with muscle involvement there, but I suppose they are all involved, the bones and the muscle.
Yes. Well, when a bone is out of place, and we're being real simple, this isn't exactly how it is, but just so the listeners get a good idea, a grasp of this. When a bone is a little out of place, it pinches a nerve, and that nerve goes to the muscle, and that irritated nerve causes that muscle to spasm up. So a lot of times when people have a muscle spasm or a muscle ache, they think, well, maybe I need a muscle relaxer because the muscle's in spasm, they want to relax the muscle. But if you don't take care of the underlying cause, which is a pinched nerve, then you're not going to get rid of the problem. Now, sometimes we sleep at night and we wake up and we feel good, and that's because the body gave itself an adjustment while you were sleeping. So probably 90% of all adjustments take place while you're sleeping. It's that gentle. It's the 10% that don't get corrected that people need to see a chiropractor.
All right. Well, it's an interesting topic. You did make it very simple and very clear, and we appreciate that. I know you have a website where people can learn more.
Yes, www.warnerchiro.com.
warnerchiro.com. And then, of course, the address is 4855 East State Street in Rockford, and the phone number,
815-398-8111.
Dr. Jim Warner, along with Kim Osborne, and thank you so much.
Thank you. Have a good day.
And that's going to do it for Health Matters today.